質詢。
Questions. Apart from 6 oral questions for this meeting, I permitted Mr. Chen Hangpan, Mr. Kwok, Dr. Kwok and Dr. Helena Wong to respectively ask an urgent question under Rule 24(4) of the Rules of Procedure, as the 3 urgent questions are about the contingency measures for coping with the epidemic of the Middle East Respiratory Syndrome. To facilitate members' follow-up, I'll first call upon the 3 members to ask their urgent questions and the public officers to reply to the 3 questions respectively. I would then invite the 3 members and other members to respectively ask supplementary questions. I will appropriately adjust the time for members to ask supplementary questions. Urgent question 1, Mr. Chen Hangpan. Chairman, a man who had come into contact with a confirmed patient of Middle East Respiratory Syndrome, MERS, in South Korea, arrived in Hong Kong by flight from South Korea on the 26th of last month. It has been reported that the man was questioned as he had a fever by a health officer about his condition at the boundary control point at the airport, but he concealed his history of contact with a confirmed MERS patient and was finally allowed entry in Hong Kong. Subsequently, this man went from the airport to Huizhou in Guangdong province via Shanghai Kwok by taking 2 cross-boundary coaches, and he was confirmed later to be a MERS patient. Since the man traveled together with quite a number of people on public transport during his stay in Hong Kong, quite a number of members of the public are concerned that MERS may spread in Hong Kong. In this connection, would the government inform this Council, 1, of the urgent and effective means adopted by the authorities for tracking the passengers who had come into close contact with the man when they traveled on the aforesaid 2 cross-boundary coaches, so as to take follow-up action immediately. 2, of the contingency measures adopted by the authorities to handle the situation where persons entering the territory conceal from quarantine officers information relating to an epidemic, whether the authorities currently have the statutory power to compulsorily place a person at the boundary control points under isolation and compulsorily arrange the person concerned to receive further examination when the authorities have reasons to believe that the person concerned is infected with MERS. And 3, given that a number of new MERS cases in South Korea has continued to rise in recent days, whether the authorities have grasped the latest situation of MERS epidemic in South Korea so as to take corresponding and urgent measures immediately, whether the authorities will, in response to the prevailing situation, immediately raise the alert response level and issue health advices and warning to those Hong Kong people who intend to travel to South Korea for sightseeing. Secretary for Food and Health. The Middle East Respiratory Syndrome, or MERS, is caused by coronavirus. The virus was not found in human in the past, and it was different from the coronavirus causing SARS. The patient can have serious respiratory syndromes such as a fever, coughing, short of breath, and difficulty in breathing. Most of them will also have pneumonia. It has not been confirmed that the virus is spread in a certain channel. According to the information available, MERS coronavirus may infect people through contact with animals such as camels, the environment, or confirmed patients. Since September 2012, Hong Kong has already listed MERS as a reportable statutory disease under the Prevention and Control of Disease Ordinance Cap 599. Any suspected or confirmed cases must report to the Center for Health Protection for follow-up investigation and follow-up. To better respond to such risk, on the 12th of June 2014, the government announced a contingency plan on MERS, setting out the government's detailed policy to respond to the disease. On the same day, in accordance with the contingency plan, and after considering the information from WHO and other factors, we have triggered the alert system. Based on the above background, I will reply to the 3-part question as follows. First, the Center on Health Protection is aware that a 44-year-old man who had close contact with the 3rd MERS patient in Korea that is the subject patient, came to Hong Kong on the 26th of May 2015 before going to the mainland. CHP immediately contacted WHO, the mainland authorities, and the Korean health authorities to get the latest situation. According to the investigations, the patient took Helena airline flight OZ723 and arrived in Hong Kong at 1 p.m. On that day, and then he took 2 cross-boundary coaches operated by Eternal East Cross-Boundary Coach Management Limited to go to Huizhou via South Kwok. Before that patient was confirmed as a MERS patient by the mainland authorities, CHP already took measures with the relevant parties such as Immigration Department, the airline company, and the Eternal East Bus Company to track the people who had contact with the target patient, including those who had taken the same flight or the coaches with the patient. Altogether, 158 passengers were identified to be with the patient in OZ723. 81 were seated near the patient, and 29 of them within the next 2 rows of the seat taken by the patient, and they were defined as people with close contact. As for the bus company, the CHP already contacted the management company and also traced the people who had contact with the patient, including the drivers and the staff. And the bus company has not kept any passenger list. Therefore, CHP has to make appeals to those who have taken the 2 cross-boundary coaches to contact the center for follow-up. As said, the 1st of June 2015, all the 29 people with close contacts on that flight were confirmed. 19 of them have been sent to the McLeod holiday camp for the quarantine observation. 10 of them are not in Hong Kong now. The information has been sent to Immigration Department for follow-up. There are another 27 who had contact with the patient, including ticketing the staff of Eternal East, the bus drivers, and also a passenger. They were under medical observation, and the tracking of patients is still ongoing. The CHP has set up a hotline to encourage those concerned to contact the authorities as soon as possible. Second, the Department of Health has been monitoring the body temperature of arrivals, and also to carry out investigations on people with fever. And there are epidemic and clinical criteria such as whether the body heat is over 38 degrees Celsius and whether there are signs of respiratory infections. On the epidemic standards, those who have visited Middle East countries or areas affected by MERS, or those who have had contact with patients with MERS will be covered. If the criteria under the 2 sets of criteria are met, the relevant person will be referred to the HA for quarantine observation. At present, our laws empowers our quarantine officers to check suspected MERS patients and subject them to further examination. According to Prevention and Control of Disease Ordinance, CAP 599, regulation rather, CAP 5998, if the health officer has reason to suspect that anyone has had close contact with a patient or has been infected, the officer can request that person to be subject to medical observation or medical checks and analysis. And we need cooperation from travelers in our boundary checkpoints in order to carry out the screening process. If travelers willfully provide false information, the Department of Health would take enforcement action after seeking advice from the Department of Justice. In the light of the MERS situations, and we have not been able to get all the information from the Korean authorities on the medical institutions that the MERS patient had visited. Therefore, we have stepped up our monitoring system. Anyone who have visited any medical institutions in Seoul, Korea, with fever or respiratory symptoms will be identified as a suspected MERS case. All people with fever will be referred to the quarantine officer for assessment, and they will be asked to sign an assessment form to confirm that the information is correct, and they will also be reminded of the legal consequences of providing false information. In accordance with the MERS contingency plan, we have triggered an alarm system, and there will be the streamlined command system. In the Food and Health Bureau will coordinate all the contingency plans, and the Department of Health and HA will be responsible for risk assessment and the setting of alarm level. According to the Korean health authorities, all the new patients are related in epidemic terms to the index patients. There's no evidence to show that there's continuous person-to-person transmission of MERS in Korea. After assessing the relevant risks, we don't think we need to upgrade the alarm level at this point. On the 3rd of June, we held a interdepartmental meetings so that all the departments concerned understand what to do to prevent the spread of the disease. We will remind people that if it's not absolutely necessary, please do not visit Seoul, Korea, or they should not go to any medical institutions there. We also propose that we will suspend any medical exchange with medical institutions in Korea, and we would monitor the latest situation and communicate with WHO and the mainland authorities and other governments continuously.
Second urgent question, Dr. Kwok. In South Korea, a spate of 20-odd infection cases of the Middle East Respiratory Syndrome MERS has occurred recently. On the 26th of last month, a man who had come into contact with a confirmed patient of MERS in South Korea came to Hong Kong on a flight, and then he went from the airport to Huizhou in Guangdong province via Shuttle Kwok by taking 2 cross-boundary coaches, one after another. The mainland authorities subsequently confirmed that the man was a MERS patient. In this connection, will the government inform this council? 1. Since the outbreak of the MERS epidemic in South Korea, whether the authorities have enhanced the mechanism for mutual notification and assistance with that country and other relevant countries regarding the MERS outbreak so as to curb the spread of MERS in Hong Kong? If not, whether they will immediately do so. 2. Whether the authorities will immediately drop a list of MERS-infected areas which Hong Kong people should avoid visiting. If so, of the details. If not, the circumstances under which they will consider drawing up such a list. And 3. Whether the authorities will immediately review if the existing public health care system, including the isolation wards, healthcare personnel, medical apparatus, and drugs in various public hospitals, as well as isolation facilities for providing temporary accommodation to people suspected of being infected with MERS, is capable of coping with an outbreak of the MERS epidemic. Secretary for Food and Health. MERS outbreak happened in some of the Middle East countries since 2012, and recently there was an outbreak due to an important case in Korea, and the Center for Health Protection has been liaising with the WHO and the mainland authority and the Korean authority in close contact and get the latest information. We will continue to monitor the updated development overseas and also to liaise contact with our counterparts and to adjust our responsive measures and surveillance when necessary. The government has been monitoring the outbreak of MERS in the Middle East and in Korea. So far, there is no evidence to suggest a continuous person-to-person transmission in the communities. After assessing the relevant risk, we considered at this stage not necessary to raise the alert response level. However, this morning we had a cross-department meeting for different departments to get the latest information about the disease and to implement the responsive measures. And the government has been reminding outbound travelers to pay attention to personal, food, and environmental hygiene, and especially for residents traveling to Seoul of Korea, they should not visit the health organizations in Korea unless it's absolutely necessary. They should also avoid visits to farms, barns, and markets with camels. And we've also suggested that personnel in health organizations in Hong Kong to stop any exchange or visit activities with their counterparts in Seoul. Regarding MERS, the HA has implemented the preparedness plan for MERS, including a heightened awareness for frontline the medical staff, and also appropriately report suspected cases. As far as preventive measures are concerned, we have stocked 1 million N95 masks and 30 million surgical masks, which should last for 90 days. And we'll also monitor the use of isolation wards. As of the 1st of June 2015, the HA has 1,300 isolation beds in 630 isolation wards. And the HA will also closely liaise with the Center for Health Protection. Any suspected case will be referred to the Princess Margaret Hospital Center for Communicable Diseases for further quarantine and inspection. And all clusters will also provide support, and the latest information will be provided in the dedicated website in the intranet of HA to keep the staff informed. And the public hospitals have also implemented a series of enhanced infectious control measures. For example, all residents and patients visiting outpatient clinics and A&E of public hospitals will be required to wear surgical masks, and that patients with fever and flu symptoms but without any travel history will be required to wait in the flu isolation zone set up at the A&E wards. The public hospitals have also enhanced the relevant isolation and quarantine arrangement to require any patient who have any symptom of flu and respiratory diseases and who have gone to the affected areas in the past 2 to 14 days to receive a virus test and to be isolated. To prevent disease from spreading, the government will act in accordance with the regulation in Part 5 of CAP 599A, Prevention and Control of Diseases Regulation, to quarantine close contacts of MERS patients. In relation to the first MERS case imported from Korea to China on the 29th of May 2015, the government already closed the Lady Maclehouse village center and changed it to a quarantine center under LCSD to arrange for a quarantine by close contacts of MERS patients. As of the 2nd of June 2015, 19 such persons have been quarantined, and so far they have not shown any symptoms. The government will continue to monitor the latest development and adopt appropriate preventive isolation and treatment measures to ensure public health.
The third urgent question, Dr. Helena Wong. Given that 20-odd confirmed cases of Middle East Respiratory Syndrome have recently been found in South Korea, and that the authorities have enhanced the infection control of MERS in public hospitals, will the government inform this council whether it will require with immediate effect all people from the Middle East and South Korea to complete and submit health declaration forms when entering Hong Kong by sea or by air? If so, the details, if not the reasons for that. The Secretary of Food and Health. Mr. President, the Health Department has all along been checking the body temperature of inbound tourists, inbound visitors, and also there is a mandatory referral criteria for MERS covering epidemiological and clinical criteria. Clinical criteria includes body temperature reaching or above 38 degrees with infection symptoms of the respiratory channel. Epidemiological criteria include those who are residing or who have visited places or countries affected by MERS and who have close contacts with people suffering from MERS. If they fall within the criteria, the visitor will be referred mandatorily to the isolation ward of the hospital authority for further inspection. In response to the latest outbreak in South Korea, because we are unable to obtain information of medical names, information on medical institutions in South Korea affected by MERS, those who have visited Seoul of Korea, any of the medical institutions and have fever and respiratory syndrome, they will be identified as suspected MERS case. All fever cases will be examined by our Port Health of port health officials, and the visitors are required to sign the assessment form and be reminded of the legal liability. The authorities will keep a close watch on the latest development and will adjust our health control measures.
I now invite members to raise supplementary questions. Mr. Chen Hang-Pang, although this time the government acted very quickly to quarantine the people concerned, but so far the government hasn't been able to get information on relevant medical institutions from the Korean government. We have close exchanges with Korea, and many people would like to travel to Korea for work or for vacation, and the summer vacation is just around the corner. Many people may have planned vacations to Korea, but the government hasn't provided any warning or advice on such trips. People are puzzled as to what they should do. So on what basis or under what circumstances will Korea be, will Hong Kong SAR government be prepared to issue traveling warnings? Well, one of the important factors that we need to consider is the WHO information on the situation with epidemics in different countries and regions. So far, WHO does not support anything that would target Korea, any travel restrictions that would target Korea and other affected countries. As Mr. Chen has said, we're very concerned that because there are close exchanges between Hong Kong and Korea, and many Hong Kong people go to Korea for different purposes. According to the information we've got, all the 30 cases in Korea are directly or indirectly related to the first patient who had visited the Middle East, and he's the index patient of all Korean cases. At present, there is no evidence that there is continuous communication of the disease within the Korean community, and therefore we just target the institutions with highest risk, and i.e. the medical institutions. If Hong Kong people have to visit Korea, then we would like to seriously advise them to avoid visiting any medical institution in Korea. If they have to, they should take precautionary measures, including wearing a face mask, and also to pay attention to hand sanitation. Dr. Kwok, well, we have gone through the SARS in 2003. It's a bitter experience we can never forget. And I believe the Secretary shared this view. In some cases, the medical personnel only contacted the index patient for 5 minutes and was infected. So this index patient could be a very powerful carrier. So we have to look forward. 2 points here. So far, Korea has not been able to tell us which medical institutions have been affected by the epidemic. And now you just check those who had a fever and who have visited Korea. That is to say that those who are infected will be checked. Why don't you check those people who don't have fever, who have visited medical institutions in Korea? And although some may not have fever, they may have some respiratory disease symptom. Why don't we be more proactive and check these people? As for the point that we need to rely on WHO, I beg to differ. Remember when we were hit by SARS, Hong Kong got the most experience, and the information was very rich in Hong Kong. You know that the head of WHO, Dr. Margaret Chan, was our director of health. At that point, she was unable to give us good advice. So now the secretary is relying on the WHO. That is Dr. Margaret Chan to decide whether to issue travel alerts. Why can't you be more proactive? Please do not wait until we have many cases where we have the third generation or fourth generation cases before we act. I want to point out 2 points. Actually, I have said this. Not all patients with fever, or not all people with fever will be subject to checks. If they have fever or respiratory disease symptoms, checks will be conducted. Second, well, actually, we are going beyond what are the jurisdictions and the guidelines as warranted by WHO guidelines. So far, we haven't been able to get a list of all the medical institutions affected by the epidemic. Therefore, we have taken some measures that anyone who has visited any medical institution in Korea, if they have these symptoms, they will be regarded as suspected cases. And we also urge Hong Kong people to stay away and not visit stay away from and not visit any medical institution in Korea. And we have also suspended all medical exchange programs with Seoul and the Korean medical institutions. Sorry, Dr. Kwok, please wait for the next round. There are 17 members waiting. I asked him to be more proactive and forward-looking. I believe that has not been answered. Well, I believe other members would raise those questions if it has not been answered. Dr. Helena Wong, the Secretary has said time and again that Korea has not been able to provide us with a full list of affected medical institutions. Have you ever tried to ask the Korean government to do so through the WHO or through the representative office of the Ministry of Foreign Affairs in Hong Kong? You should force the Korean authorities to give us useful information so that we know which medical institutions should not be visited. It's not that we shouldn't visit any medical institutions in Korea. Secretary, since we haven't been able to get the information from the Korean authorities, we have asked the WHO to get certain information according to the rules under the WHO system. We have also talked to the relevant representatives of Korea in Hong Kong. Dr. Leung Ka-Lau, I would like to get some more clinical information of the disease. Well, what are the special characteristics of this disease? How can we tell it apart from other respiratory diseases? So apart from looking at the locations where people have gone, what are the treatment plan and what is the prognosis? I've been told that the effect is more severe among older people than young people. Secretary, I may not be able to provide all the information requested by Dr. Leung Ka-Lau. I can say something and then I can supplement later when we have more information. As I've said, MERS, the pathogen is coronavirus, as I've explained. It's different from the coronavirus that causes SARS. I think it can be communicated through droplets, and the symptoms will include fever and symptoms of respiratory diseases. But it's difficult to rely on symptoms of respiratory diseases to distinguish diseases such as MERS vis-a-vis common flu or seasonal flu. So we have to look at the other conditions. to see if the case can be regarded as a suspended case. As for the assessment and checking, we are able to do this through the genetic checks or DNA checks. We can conduct a quick test to ascertain whether the case can be confirmed. On treatment, so far, there's no targeted therapy or treatment plan for MERS. So it's supportive in nature. We have supportive therapy. It's to ensure the balanced metabolism and to prevent infection caused by other bacteria. Can we use some drugs to ease the symptoms? There are some, according to experts. During SARS, we also used some drugs, such as interferon, which can be considered, but it's not a target drug. It's not a drug that can target MERS.
Regarding risks, patients with chronic diseases or poor immunity will of course be more vulnerable. Mr. Tommy Jiang. Mr. President, I have a question for the Secretary. In fact, this time you avoided the meeting that you were supposed to go to overseas. Maybe the Security Bureau can give advice or warning to outbound travelers, and then the travel agencies should, on their own initiative, offer refunds or exchange if there are residents who have applied to go on tours. And have you considered this situation? And that you have the power to announce certain places as the affected areas, instead of allowing residents to travel there. Secretary, in fact, for the Center for Health Protection, they have been advising residents in Hong Kong when they travel outbound what they should pay attention to as far as their health is concerned, and there is such information on their website. And the situation is quite complex. It is difficult to just give any alert level 1, 2, or 3 on outbound travel. Medical advice will be involved. In fact, the Department of Health offer support services, and one of the services is that for outbound travelers to, say, Africa or to other areas, you can visit the website of the DOH on Port Health for medication, for vaccination, for certain diseases in those places. As for MERS, in relation to new measures and advice for residents, they will be announced on our website. And one of the most important piece of information here is this: we should not just pay attention to South Korea, because the affected area of MERS syndrome is in fact in the Middle East countries. So we provide more detailed instructions or advice for travelers to Middle East countries and South Korea, and that they should refrain from any contact with wild animals, and they should not visit farms and animal barns, and they should not, in particular, come into contact with camels in the Middle East. And they should refrain from visiting healthcare organizations in these affected areas. And for South Korea, we don't have this list of health organizations yet, so we advise that travelers refrain from visiting all medical organizations. Now, if somebody goes to the Middle East and South Korea, and if this person gets sick, then he has the need to go to a hospital. And we would advise the residents to wear a mask and also wear gloves. And this is not as simple as just issuing a travel alert. Mr. Christopher Chung, on the 24th of May, the World Health Organization, on its website of Global Disease Response, announced the first MERS case in the UAE, and then a case occurred in Hong Kong on the 29th. China reported to the World Health Organization of such confirmed case. So my question for the Secretary is this. According to the website, there were 1,135 such cases around the world with 421 deaths. So the fatality rate or the mortality rate is 37%. Is it considered very high risk? However, there is no advice on the website on travelers going to these places or any travel alerts. But with such a high mortality rate, and when things are still uncertain in South Korea, are we going to implement any measure to prevent further cases being imported into Hong Kong? And the website also advises people not to drink fresh camel milk or to eat a camel meat or urine. So I'd like to know whether there are such products imported into Hong Kong. The Secretary, in my reply just now, you may see that on the one hand, we are drawing reference from the policies and directions from WHO in particular in whether to issue a travel alert or health warning against any particular place. But we do not just rely on the World Health Organization. We go beyond that. We have a preparedness plan for MERS syndrome. And we have adopted measures that are not actually required by the WHO. For example, the transmission of MERS in South Korea happens mostly in healthcare organizations. So our priority is to advise people not to visit these organizations and to advise our healthcare professionals to suspend any professional exchange with their South Korean counterparts. And we've also included this element as part of the definition for suspected cases. And at all BCPs, temperature will be taken. Some ask whether this is effective, but in fact it is. We have several dozen inbound travelers per day whose temperature is found to be a bit on the high side, and that assessment is necessary at the BCP, and this is a chance for us to intervene and to get details of their contact information, the health condition, the travel history, for us to consider whether this person should be considered a suspected case for immediate inspection and quarantine and isolation. What about imported camel products? Any imported into Hong Kong? I don't have this information at hand. I can provide that later. well, we still have 13 members on the list waiting to ask questions. In accordance with our established practice, I will invite members on the list who have asked smallest number of questions in this term. And with more members joining, the order may change. So we have not shown the actual order. And the next three members will be Mr. Stephen Ho, Professor Joseph Lee, and Mr. Helena. Mr. Stephen Ho. Thank you, Mr. President. I believe after knowing about this MERS syndrome, Hong Kong people, when traveling to South Korea or Middle East countries, will be more vigilant. But I am concerned about a possible major outbreak in Hong Kong. For example, for this South Korean individual, he took 2 trips on cross-border coaches, and he also traveled to the mainland, and the incubation period could be 14 days. And it's possible that the suspected patients may return to Hong Kong within the incubation period. I want to know, without any preventive measures, how many people could possibly be infected?
First of all, I want to point out something which I don't agree with Mr. Stephen Ho. With regard to MERS, Hong Kong is relatively strict in terms of preventive measures. If we are to assess the risk of outbreak in Hong Kong, I think you need to understand the first point. Is this. It's not just MERS. Any epidemic has an incubation period. And during that incubation period, if there is the carrier has no symptom and has entered Hong Kong, there is such a possibility. We cannot exclude such a responsibility. There's the visitors coming from South Korea or from the Middle East who have been infected with MERS, when they enter Hong Kong, they didn't have the symptoms. And after they came into Hong Kong, there is an onset of the illness. There is such a possibility. But the most important thing is that in Hong Kong, at the border control points, we've already have a very strict monitoring measure. When somebody enters Hong Kong, if there is any symptoms such as fever or respiratory tract symptoms, we will discover that and we will isolate the patient. But if those who don't have symptoms who have come into Hong Kong, and then if there is the onset of the illness, then our healthcare workers have already follow the guidelines to deal with MERS, and that covers clinical criteria and epidemiological criteria. Our frontline healthcare workers are very clear about these criteria and also the related measures. As for clinical criteria, body temperatures 38 degrees or more, and also respiratory infection symptoms. You may say that these measures, these criteria may not separate MERS from non-MERS patients, but patients who have respiratory illnesses. But at least we are able to identify the symptoms, and then there are also the epidemiological criteria, and we keep on enhancing the system. Say first we targeted the Middle East, and now we have included South Korea, and we specify several conditions. Now, those who have contacted MERS cases, those who have contacted wildlife, camels and camel products, whether it is in the Middle East or in South Korea, medical institutions which have the chance of receiving MERS patients. In South Korea, we don't know which medical institution, and therefore we've covered all the medical institutions in Seoul. Now, our frontline healthcare workers are on alert. And for those who have entered Hong Kong who don't have the symptoms when were coming in, but there is an onset of the illness after they have entered Hong Kong. Now we have a system which is rather mature. If it is a suspected MERS case, then the patient will be sent to the hospital for isolation and inspection. Now, if it is a confirmed case, we have tracing and tracking, and you have seen that very quickly we have identified all those who have close contacts with the patient. And the 19 persons who are in Hong Kong have been isolated, and after 14 days, if they don't have any onset of symptoms, they can be considered safe. Even if we cannot exclude the situation in which the patient has entered Hong Kong without displaying any symptoms, we still have the arrangement for us to identify the patient early and conduct a medical examination and isolation and also admission to hospitals. Dr. Joseph Lee. Just now, the Secretary said that has given an answer from a technical point of view. We are told how preventive measures are being undertaken. Now, South Korea is the case in point, and people are asked not to go to the medical institutions in Seoul. It's common sense. People will not go to dangerous places. The issue is that apart from answering the question from a technical point of view, there is a political issue, and you have not done it. South Korea is not cooperative. It doesn't provide information. In your main reply to Mr. Chen Han-pan, you say that South Korea is not able to provide information. And in answering Dr. Kwok's question, you say that they have given you the latest information. I think it's ambiguous. You have admitted that you are not able to obtain information from South Korea, and members have asked about WHO, and you have asked WHO. From a political point of view, you need to protect Hong Kong. Have you considered complaining to the WHO because the South Korean authorities have not provided you with the information? Being an official responsible for healthcare matters, will you consider a special arrangement for anybody coming from South Korea in order to respond to the South Korean authorities, who is not cooperative? The Secretary, according to my understanding of Mr. Lee's question, from a political point of view, if we are able to obtain relevant information from South Korea and WHO and know the medical institutions that have accepted MERS patients, that is more that will be more convenient for us to deal with that case. Now, from a political point of view, should I make a complaint? Even if we do it from a political point of view, our objective is to protect the people of Hong Kong. Now, in response, we have made a suitable response. And the response is not just a political response or out of political consideration. We are unable to obtain information from South Korea. Therefore, we can only regard all medical institutions in Seoul to be high risk. So we advise the Hong Kong citizens who are to visit Seoul not to visit any medical institutions in Seoul, and we have suspended any academic exchange with the medical workers in Seoul. That is a response to the lack of information, lack of transparency on the part of South Korea. And therefore, we have introduced these measures. Since we cannot target at a certain medical institution, we can only cover all medical institutions in Seoul. From the point of protecting our citizens, I think we have suitably responded to the lack of transparency on the part of the Korean authorities. I will then give the floor to Mr. Ip Kok Him and Mr. Leung Kok Hong. My question has not been answered. In respect of those who come from Seoul, will you target them? We still have 14 members who are waiting in the line. I do not intend to allow members to ask supplementary questions. If members have asked questions which have not been answered by the secretary, then the 10 odd members in the row waiting in the queue will ask questions which will be similar. Ms. Ip Kok Him, and then followed by Mr. Leung Chi-Chow. After SARS in 2003, we have a high level of alertness. The South Korean government has dodged the question and has tried to and is not given and is not transparent enough. Can we strengthen our measures? In 2003, during SARS, for planes coming to Hong Kong, there were inspections in the cabin. So with regard to planes coming from South Korea, will you conduct similar inspections, say in the cabins? So that this will not happen, such an illness will not happen in Hong Kong.
Secretary, our port health officers have been in close communication with the relevant sectors, including the tourism sector. As I've said, every week we have more than 200 flights coming to Hong Kong from South Korea. We have contacted all the airline companies, and according to these airliners, they have stepped up their efforts. They will make in-flight announcements to passengers saying that if they have symptoms, they should contact Hong Kong Port Health Authority. They will also step up their monitoring of health conditions of passengers. Mr. Leung Kok Hong, I find Dr. Koh's answers amusing. If they are not cooperative, we'll do something to counter that. And it's just like, well, I was denied entry into Malaysia, and the SAR government said we respect their decisions. If you cannot, if you can tolerate the South Korean government's inaction, what about the mainland? You have so many checkpoints at the airport, and people who use buses and other vehicles. What about the drivers, the motorists? If Wang Yang drove a car to Hong Kong, well, would you check his body temperature? Would you dare to check passengers coming over in vehicles? Please raise your question. Well, they would check us when we go there, but what about those coming to Hong Kong? We have so many boundary facilities. Are there rules saying that we would check those who are driving a car to Hong Kong? How many people have been checked? Are there records? Because for some of them, they don't need to be cleared by our immigration facilities? Are those people subject to checks? Mr. Leung, please be seated. Have you heard me? Let me repeat. Have you got records? Are there people with diplomatic papers? How do you check those people? Secretary, on the question of prevention measures, let me point out that first, in respect of Korean flights coming to Hong Kong, we have liaised with all the airline companies to ask them to pay more attention to the health of passengers, and also to remind them that they should report to us if they have symptoms, and we are going to have a comprehensive body temperature check system. All those with symptoms will be assessed, will have their health assessed. This is done in accordance with our law, and there's a form, an assessment form, setting out in clear details the personal particulars of the passenger, the contact information whilst he is in Hong Kong, and also the symptoms identified, and so on and so forth. And we also ascertain whether there's a contact history and travel history. We will ask the person whether he has visited any region, any place affected by MERS, and we also be more focused that in our questions whether he has contacted any MERS patients or visited any medical institution concerned. After all these questions have been put and after the check is done, the assessed passenger will be reminded of the legal responsibility, and a signature will be required to confirm this. Well, the question is whether there are passengers who will not be subject to body temperature check because of their special status or special mode of entry. All the arriving passengers will be subject to body temperature checks. If they have a fever, they will be subject to assessment. Mr. Leung Kok-hong, your question has been answered. Please be seated. Well, there are travelers who have travel documents, but what about those who don't have any travel document? Are they travelers? Well, your question has been answered. Please be seated. Mr. Leung Chi-chung, MERS is also known as new SARS. It's communicated through droplets. In your reply, you talk about the definition of a person with close contact with a patient. It said that 158 passengers were on the flight. 81 were targeted by you. But according to a definition, only those sitting in the next two rows will be people with close contact. So after investigation, these 28 were isolated. Given this definition, I'm worried that although we have experience, especially in the post-SARS era, we have had some sort of experience in preventing the spread of an epidemic like this. If the infected South Korean moved around during the flight, or he changed his seat during mid-flight, there will be other people who might have been infected. Would you suggest that all passengers or on board a plane or in a bus should wear face masks? Secretary, for the hygiene reasons or for whatever reason, it would be good to wear a face mask, but we won't make it mandatory. When we define who are regarded as people with close contact in a flight, we would have to consider the scientific background. Well, this is spread by droplet. It has to do with the distance from the patient and also the mode of transmission. In Australia, in the UK, they have set some criteria for the flight attendants and the captains. We also, or the pilots, we all define them as people with close contact. We don't say that those sitting farther away in some other rows of the plane will not be regarded as people with close contact. We are saying that people who could have been exposed to the range of affected by droplets from the patients to be people with close contact.
Next three members are Mr. Felix Chung, Dr. Elizabeth Kwok, and Ms. Sit Ho. Mr. Felix Chung. Now, if people make false declaration on the health declaration forms, any person doing so will be fined $5,000 or imprisonment for 6 months. But in this case, the person, the South Korean MERS patient, immediately went from Hong Kong to Huizhou. So what could we do about it? Should we wait for his return from Huizhou to Hong Kong for transfer to South Korea before we prosecute him? Secretary. Mr. President, for this patient, of course, when his health was assessed by our staff at the BCP, he provided false information for health declaration, and we take this matter very seriously. And we are seeking legal advice from the Department of Justice. If in their view there is sufficient evidence, we will consider taking legal action. However, he is not in Hong Kong at the moment, as you said, so he must be in Hong Kong before we could enforce the law. Dr. Elizabeth Kwok. Mr. President, in Hong Kong in 2003, we had the SARS outbreak, so we're very concerned about the new SARS outbreak or MERS outbreak. And the situation in South Korea is quite tricky. There are people traveling to South Korea for business purposes, and they really have no choice. And Secretary mentioned that people should avoid visiting health organizations in South Korea unless it's absolutely necessary. But they may get sick, and they may really need to seek medical help. And what will Hong Kong government do to help those who need medical help in South Korea but cannot visit health organizations? Will there be a hotline for Hong Kong residents? And when after they have visited the healthcare organizations in South Korea, when they come back to Hong Kong, will they be isolated? Secretary. Mr. President, as I mentioned in my previous reply, if for various reasons residents need to travel to Seoul in South Korea, we advise them not to go to health organizations as far as possible. However, if for some major reasons or for health purposes, a resident needs to visit such an organization, then although we don't know the actual mode of transmission of MERS, except that it could be transmitted through droplets, we would advise the person to wear a mask to protect himself, and that the hands should be cleaned after coming into contact with anything. This will be an effective measure to guard against MERS infection. Ms. Sidho. Thank you, Mr. President. I hope that the Secretary could compel the South Korean Health Authority to make known the situation of MERS to us. And I'd like to follow up on the other member's question on a coach. Passengers might be sitting very close to the MERS patient in such a close environment. At the BCP, temperature checks will be conducted. Well, if the situation in South Korea gets worse, will the government consider, before passengers board the plane bound for Hong Kong, will temperatures be taken for these passengers? So that decisive action, you may consider decisive action such as not allowing passengers to board the plane, or at least to identify passengers that we need to pay particular attention to. Secretary, as I mentioned in the reply about the action that we have taken an active approach in contacting the 200+ flights traveling from South Korea to Hong Kong. We have been requesting these airliners to give appropriate public announcements reminding passengers traveling to Hong Kong to pay attention to the health warnings and their health conditions. I think this is important. Well, if during a health assessment conducted by us, the passenger shows the relevant symptoms and that according to the passenger's travel history, the passenger has been in contact with a MERS patient or has visited the MERS or healthcare organizations, then the passenger will be regarded as a suspected case. But I think it's quite difficult to request the country's concerned to do anything. Mr. President, I'm referring to the airliners. Anything to add, Secretary? Nothing. Next, I'll invite Ms. Alice Mack, Mr. Wong Kwok and Dr. Kenneth Chan to ask questions. Ms. Alice Mack. Mr. President, after SARS outbreak in Hong Kong, I believe our healthcare professionals in Hong Kong would be more vigilant and more experienced in handling possible outbreaks. However, we are facing a very irresponsible counterpart. As the president in South Korea admitted, they do not have adequate preventive measures, and we can't get adequate information from them. And as you replied to questions from Mr. Chen Han-pan and Dr. Kwok, you said that there is no evidence of sustained community-level person-to-person transmission. And yet, if, as you said, they are not even willing to disclose the list of healthcare organizations involved, then are you underestimating the situation? Not intentionally, but because of inadequate information. And should we step up our preventive measures? Now, instead of asking outbound travelers not to visit health organizations in these places, maybe you should issue travel alert and advise travelers not to go to these places instead. Secretary, Mr. President, as in my previous replies, issuing a travel alert against any particular country will be subject to the WHO's advice. But most importantly, we should consider whether there is sustained transmission at the community level. Of course, we note the lack of transparency as far as information in South Korea is concerned. But I need to clarify that when I said that there is lack of transparency, I am referring to their inability to provide the list of affected healthcare organizations to us. And as for the 30 cases reported, And the details of these cases, such as where the transmission has taken place, etc., we have these details. And according to information, there is so far no sustained transmission at the community level in South Korea. And that is why, under such circumstances, the travel alert will not be issued. However, we do feel that we should advise residents in Hong Kong. And in fact, the advice given by us has exceeded the WHO's requirements, and that is we advise travelers not to visit healthcare organizations in South Korea or have exchange with healthcare professionals there as far as possible. So we have actually go beyond the WHO's advice. Mr. Wong Kwok. Fortunately, the filibustering has come to a halt. Otherwise, we would not have been able to ask questions of public's concern. And my question for Secretary is this. About temperature checks at BCP, according to media reports, the staff responsible for temperature checks are actually on the contract terms, and there is low staff morale because of same job, different pay. And have you considered or have you paid attention to this fact that the staff members conducting temperature checks at BCPs are on contract terms? And will their terms be changed to permanent ones? Or what will you do to boost staff morale so that they could do their jobs of conducting temperature checks properly?
Mr. President, there are more than 600 colleagues at the port health, at the port checkpoints, border checkpoints. Now, they are civil servants and contract staff. I want to tell Mr. Wong very clearly that we do provide the relevant training to our colleagues. As for the number of staff members needed to conduct the task, that depends very much on the situation of the epidemic. If it is a very serious situation, we may need to enhance manpower for a certain period of time. With regard to contractors, those who are staff members of the contractors, they are given training. And even if we are to deploy our colleagues to do that, they also have received training. But he has not answered the question whether same medical protection be given. I've already said that many members are waiting in the line. I do not allow follow-up questions. Dr. Kenneth Chan. Mr. President, while we are still discussing this problem, there is an exchange group from the university who have gone to Korea, and some people on business have gone to South Korea. You really need to review your travel alert arrangements. Otherwise, there will be people who will be exposed to unnecessary risks. I want to follow up on the question in respect of the South Korean man who passed by Hong Kong and went to the mainland. There were 19 people who had close contacts who had been identified, but there are still 10 who have yet to be contacted. And now you say the information has been provided to the Immigration Department. Are these 10 persons people, citizens of Hong Kong? And when they come back to Hong Kong, how can you make sure that the Hong Kong is safely protected? In fact, we are reviewing the situation every day. Every day, I pay very close attention to the development in South Korea, how many new cases have been reported, and whether there are cases in which there are fourth-generation cases or cases without an identifiable source. These cases may reflect that there is continuous transmission in the community. Though there is no interdepartmental meeting every day, I am looking at the situation closely every day. As for the other 10 persons with close contacts, we pass on the information to the Immigration Department because they may come back to Hong Kong and we can therefore get them. There is one out of the 19 who came to Hong Kong again and who was found. Now 6 out of the 10 are now being monitored in the mainland and 4 have returned to South Korea. Their information is given to the Immigration Department as well as the local health authorities of the relevant places. If they come back to Hong Kong, the Immigration Department will be aware of that. Are there Hong Kong citizens among the 10? I don't have information. I will provide information later. I will ask Mr. Yu Si-wing, Mr. Sin Chung Kai, and Mr. Lo Wai Kwok, and Mr. Po Che to ask the questions. Mr. Yu Si-wing. Thank you, Mr. President. Last year, with regard to MERS, the authorities, including the Secretary, met with the travel agents, and we were informed on the preventive measures. That was a good arrangement. Many more people are going to South Korea than those going to the Middle East. In view of the recent situation, will the administration step up publicity so that the travel agents and also visitors who are bound for South Korea or Middle East will step up the preventive measures? Thank you, Mr. President. We are working very closely with the TIC. There are close contacts, and we update the TIC. From time to time, we provide the guidelines so that they can take care of the visitors or the tour group members. We also remind the travel agents that if they have tours to the Middle East, they should not make any arrangement for riding to camels or come into contact with camels or camel products. If need be, we can make suitable arrangements to have further seminars. Mr. Sin Chung Kai. Now, Mr. President, visitors do not go to the medical institutions unless they suffer from a traffic accident or suffer from an injury because of sports. And South Korea is famous for cosmetic services. I don't know medical institutions are part of the cosmetic institutions. Mr. Secretary, will you ask males and female visitors to visit these cosmetic service institutions? The Secretary, I have clarified that when I make reference to medical institutions to Seoul in Korea, I do include those institutions that provide plastic surgery or cosmetic surgery. Dr. Lo Wai Kwok. Now, the Department of Health has been able to identify those who have contacted the South Korean male who is now in Huizhou. One of the students of the Puikyo Secondary School is involved, and suitable measures have been taken with regard to the school. A school is a high-risk place if there is an outbreak. As the Secretary, consider issuing guidelines and warnings to the schools so that we can be on alert and introduce preventive measures. Thank you, Dr. Lo. At this morning's interdepartmental meeting, the representative of the Education Bureau has already said that the guidelines given by the CHP have been transmitted to the schools. And we would like to remind the schools that they should pay special attention to the health situation of their students. A standing arrangement is that if any student has a fever or is indisposed, then the student should put on a mask, should take a rest, and go to see a doctor. Mr. Paul, Chair, the people of Hong Kong are very concerned about this problem because they have been scared. But are we in a panic? Are we are we excessive in terms of being too scared? Now, the travel warning doesn't include healthcare matters. The latest warning is just in respect of Ebola in Guinea. And we are also reminded of MERS. We are informed that the latest number from the WHO is that there were 1139 cases, 43 deaths involving 24 countries. In Asia, apart from South Korea, Philippines and Malaysia are also on the list. I hope that the authorities will not just put emphasis too much on South Korea. That's unfair.
There must be some balance here. During SARS, we cordoned off a hotel which hurt our tourism industry a lot. Please raise your question. You have mentioned the interdepartmental structure or the command structure. Will there be anyone from the CEDB or the Hong Kong Tourism Board? Is there appropriate assessment so that we will not do a heavy blow to our tourism industry? Secretary, I can tell Mr. Chair this. It has been pointed out in the past few days and through the news that not just Korea has been affected by MERS. Some Middle East countries are also affected. And I mentioned this time and again. There's no advice asking people not to go to the Middle East. But if you go there, all travelers should not contact camel products, or go to any environment where camels are present. So we are not going to target a specific question, or we're not going to be unfair to a particular country in our policy. At our interdepartmental meetings, there are suitable representatives from the relevant bureaus and departments. So I don't think there's any imbalance here. Mr. Alan Leung, Chairman, I'm most concerned about this issue. If we want to protect the public health in Hong Kong and Hong Kong people, then would the government consider that for those who are vulnerable, for vulnerable groups, would there be some advice on traveling to South Korea in the form of an alert, in the form of an advisory message? So far, we haven't got any. So I would like to ask the Secretary when you are going to do this. Well, if you wait for a direction from WHO, well, WHO is far away from Hong Kong, so people are concerned when you are going to do what I have suggested. Secretary, simply put, I can tell Mr. Leung that I have been reminding people that they should not visit any medical institutions if they travel to South Korea. And also for those with chronic diseases and who has a low resistance level in the immunity system, they should be careful whether they go to the Middle East or to Korea. If they visit risky, high-risk medical institutions, they will face higher risk than other people, so they should avoid such visits. And if they have to, well, they have to take the precautionary measures, which I don't need to repeat again here. That's the end of this particular part of our question time. Question number